right, so today we've got something a little different for you. I'm all about the tech, and so is our next guest. So much so that he has started using Google Glass during his surgeries. It's awesome.
That's cool.
Please welcome Dr. Castellano. Good morning,
Hi, doctor.
Thank you
Good
for having me
morning.
So you are a Google Glass doctor. You're a man after my own heart. So tell me about working with Google Glass as far as your practice.
So the optical head-mounted display is a great tool for physicians, and physicians are exploring the potential in their practice. We use it for taping with surgery. It's good to chat with other colleagues. We tend to do a better job when we're being watched.
Right.
So it's an excellent tool. So we'll demonstrate here today. When I'm doing procedures in my office staff can be remote in the office and say, oh, that's what he's doing. So it's an excellent gadget and an excellent tool as well.
So it's good for the doctors and for the patients as well?
Right, so for the patients to use it at this stage, because it's in beta testing, they need to sign a release that they're okay if it shows up on YouTube or the Daily Buzz.
Right.
And so if they want that privacy, they can't use it at this stage yet.
So we have one of our producers, Cece,
Yes,
here.
it's
She's
Cece.
Volunteered to be touched by you. So what's going to
Yes.
happen today?
So we're going to just do a little of the Botox and fillers, and then they'll show you through the display of what I'm seeing. So it's not like we're doing surgery, but just for demonstration purposes,
Okay.
you'll see how we can use it first-person camera, and it's a really effective tool.
And this is
How
completely
fun is
safe,
this?
and you're feeling comfortable about this?
Yeah.
Okay. All right, so let's get started. Let's
Sure,
yes.
absolutely. So
right.
we're starting out with something very simple, just a little bit of the Botox. And Cece has had the Botox before. We talked that we wanted something that was natural and light and not
Right.
overdone. So frown down real hard like you're angry, although I know you never get angry,
Never.
but okay. And then
And what we're seeing here is we're
This is
seeing
a little
the
bit
feed
of the
from the
Botox.
Google Glass
Right,
in
and
the
relax,
screen right there.
relax.
That's on your cell phone.
that's what I'm seeing right now. And so you feel a little pinch, 1, 2, 3, pinch. And then we
And the
just,
glasses, they don't distract you at all?
well, it depends on what you focus on.
Uh-huh.
So, no.
Okay.
You've got the option to look up in that upper right-hand corner, pinch.
And
Cece,
is there
beauty is
any? Now, I
pain.
know Google Glass has a lot of information on the screen. Do you use some of that during your operation, like a cheat sheet kind of thing? Or?
If you forget what you're doing, it's nice to have a little checklist. So you can bring up pictures
Okay.
Right.
and have people, if it's nice to look at the photos while you're doing the procedure during surgery, and you don't have to look away and see where your other before pictures are. So you feel another little pinch here on 3.
So what
1, 2,
Cece's getting done today, she's getting Botox
a
on
little bit of the
her
Botox to
forehead.
soften the wrinkles.
What
Yep.
is the biggest, people are always so afraid of getting injections and stuff like that because they're going to end up looking like Bruce Jenner or Kim Kardashian.
Sure,
It's not like that, right?
Less is well. The most important decision is who's doing it for you.
Okay.
Exactly.
Why do
And
these
so-
celebrities end up looking like this? They just go overboard? Is that the problem?
Some people actually do ask for that. Not many. Most people want a natural look, and so the ones that look natural, you never see it because they look so good.
Like Christy Brinkley?
Well,
because she's like in her 50s. I'm sure she's had more than Botox.
right? Yeah. When they look that good, you say they must have had something done. Pinch.
Right. So Botox
How you
is a
doing?
pretty
You doing okay?
standard,
Doing great.
standard operation here. I mean, how in-depth are the surgeries that you use with Google Glass get?
So we do facelifting procedures,
Wow.
eyelid laser treatment, laser lipolysis, which is similar to like a smart lipo, can also be used with the technology. And it's just a great way to share, a great way to capture video and archive. Raise your eyebrows up real high. Now relax. Okay.
Have you ever had someone hesitant, like, no,
Pinch,
I don't
1,
want
2,
you to show that I've gotten Botox or whatever it is. I don't want to be on your Google video.
My secret's out.
Yeah,
That's
exactly.
in there at least one,
Do you know
I'm
the cameras are rolling?
Right?
How many millions of people are seeing this right now? My
How you
secret
feeling,
is out.
Cece? How
I
you
feel
feeling?
great.
Yeah?
He's wonderful.
Great. You're
Pinch, 1,
looking
2, 3.
Botoxed.
Yeah.
So talk about the future of, this is obviously in beta right now, you have to time release.
Pinch.
Talk about the future of this in the medical field. As far
So, 90% of all phones that are sold today are smartphones.
Right.
And so it's just going to be a matter of time before everybody is using these types of devices. Whenever you go out in public, everybody wants to try and be like, that's amazing, let me try that, that's so futuristic. And you make a scene. I was in Whole Foods with my kids and meeting total strangers, and then even though you might look cool wearing Google Glass, when I was picking up my 6-year-old salad spill all over the floor wearing
Right.
Google Glass, didn't look so cool.
Right.
But
So
it's,
you wear this, this is not just a tool for the office, this is your lifestyle, you wear this every day.
I do wear it when I'm out with my family, not every day, because you're going to meet people, and some people don't want to be taped
That's what I was
by.
going to ask you. Have you ever had someone say no? Can you please
I've
take
never
them
met
off?
anyone who didn't want to be taped by it, but you know.
Because just recently there was some sort of.
Yeah, in San Francisco, there's
Yeah.
a woman at the bar who was,
Wearing her
accosted
glasses.
with those because of the
Haven't
whole.
been beaten up yet.
Yeah, I mean, well, and these things aren't cheap, right? They're $1,500.
Right, it's
you have to be part of
expensive.
a special program.
Correct.
So these aren't for the everyday person. So it's
That's-
kind of like wearing a fancy watch on the street.
That's correct. And I've been in touch with the Google developers because when I've been using it during surgery, little pinch, using the electrical cautery, it gives some stimulation to the device, and it would start doing searches just randomly.
Oh, really? Okay.
While I was doing, and it was some of them were definitely not suitable for work that came up, but it was a little comical. But you know, we've been in touch to say how do they get that under
Yeah.
control and control the electrical stimulation while we're doing procedures. So I'm just going to do a little bit of filler here. This is the
CC, oh,
Juvederm.
that's it.
Give us a thumbs up, CC, if you're feeling all right.
She's doing
I'm feeling
good.
it. This is my.
Well, careful, not to,
So
don't move
CC
don't move your face.
So
Don't move
CC,
your
you're turning
face.
25. Is that
move your
pretty much
face.
it?
Yeah,
Okay, you're
that's
just
it.
kidding. And you know, when I asked you this question at the beginning, if the glasses are distracting, obviously they're not. You're talking to us. You're doing this on CC's face.
Right.
I think I need some for Christmas.
Yes.
for my birthday.
Doctor,
Go ahead.
this is a good thing for medicine in the long run?
Absolutely, no doubt about it.
Perfect. Well, you have a book as well. We've got so
Yes.
much more information. We're going to give you some before and after pictures of CC
Yes.
on our website, dbz.com. Check that out, too. I love
Yeah.
it. Tech and
CC.
surgery on the Daily Buzz
CC.
today. Stay with you. You can't beat that.